Hello everyone, my name is Floris van der Veke. I am a senior year medical student at the Vrije Universiteit Brussel and I am doing my master's thesis at the neurology department. Today I will be presenting our research paper, Brain volume loss occurs at the rate of normal aging in patients with multiple sclerosis who have no evidence of disease activity status. Brain volume loss recently emerged as a clinically relevant MRI marker for neurodegeneration in patients with MS because it correlates with present and future physical and cognitive disability. Also, brain volume loss seems to proceed 3 to 5 times faster in subjects with MS compared to healthy controls. No evidence of disease activity is a label which is given to MS patients who are free of new relapses, have no disability worsening, and have no new lesions on MRI. But to this day, it is unknown whether the degree of brain volume loss in NIDA patients actually differs from that of healthy controls. This led to us formulating the following research question. Does neurodegenerative pathology under the form of accelerated brain atrophy proceed in patients with multiple sclerosis who are free from inflammatory disease activity? In order to answer this research question, we conducted an observational retrospective case control study with patient selection at two different centers, namely the Universitair Ziekenhuis Brussel and the National Multiple Sclerosis Centers. In order for patients to be included, two requirements were necessary: a NIDA status over at least 18 consecutive months, and the patients had to be under an ongoing high efficacy disease-modifying therapy, or DMT. The selection procedure for our study was the following. In the first step, we identified all patients under second-line DMT. In the second step, we identified two MRI scans suitable for brain volume loss assessment with a minimum interval of at least 18 months. In the third step, we checked the radiological and the neurological reports to verify the NIDA status of the patient. And if all these criteria were met, the patient was included in our study. Then in the fourth step, we assembled a group of healthy controls. Afterwards, automated brain volume quantification was performed on both MRIs using iGoBrain software of the company Icometrics. Icometrics then also calculated similarity scores in order to ensure sufficient quality in the comparison of the scans. And only couples with a score of at least 0.15 were retained, which is an internal Icometrics procedure. If the similarity score was sufficient, the annualized whole brain volume percentage change was calculated for each MRI couple. So this led to the results of our final cohort. In our NIDA population, we started with 160 potential inclusions, and after the steps I just discussed with you, we ended up with 32 inclusions, 23 of which were women and 9 men. For our healthy controls, we started with 48 candidates from a previous volumetric study, but only 27 were eager to do a follow-up scan, 16 of which were women and 11 men. The demographics were the following. In our NIDA group, the female to male ratio was 2.56 to 1, with a median age of 42 years and a median of 653 days between both MRIs. In the control group, the female to male ratio was 1.45 to 1, with a median age of 51 years and a median of 973 days between both MRIs. In our NIDA group, there was a minus 0.22% annualized whole brain volume change compared to a minus 0.26% in the healthy control group. This was the primary endpoint of our study, and the results were alike in both groups. But as a secondary endpoint, we also analyzed the annualized gray matter volume change, which was minus 0.26% in the NIDA group and minus 0.34% in our healthy control group. So, in conclusion, the rate of brain volume loss in NIDA patients occurs at the rate of normal aging, and this also corresponds with rates of normal aging in literature, and additionally, the brain volume loss in our NIDA populations was also corresponding with rates of normal brain volume loss in the Icometrics database. These results suggest a significant link between the inflammatory process and the neurodegenerative process. So these results favor the idea that neurodegeneration decelerates once the inflammatory process is under control, and this might advocate for a more early introduction of high-efficacy disease-modifying treatments in the treatment of MS. And the last consideration we need to make is that brain volume loss is a biomarker which needs further validation in NIDA-MS patients in real life, because very few research has been done on this subject. This was my presentation. I thank you for your attention.